Hello, viewers. Welcome. It is an honor and our privilege to have on board with us today Dr. Vijayalakshmi Subramaniam. The reason why I chose her is very simple. I'm impressed by the amazing credentials of this multifaceted and multi-talented specialist doctor. She is the professor and head of the Department of Otorhinolaryngology and Head and Neck Surgery at Yenupua Medical College, Mangalore. At the same time, she is the founder of NADA Chaitanya Institute of Music Therapy and Research, Mangalore, and General Secretary of Indian Music Therapy Association. So it's really amazing for a busy professional to carry on profession as well as the passion. Now, to enumerate her qualifications, after completing her MBBS in 1994 from Bangalore University, she went on to do her specialization in otorhinolaryngology, head and neck from Kasturba Medical College, Mangalore in 2002. Then she completed her DNB training in 2004, and she did her PG diploma in bioethics and medical ethics in 2011. Parallel to this, she has earned qualifications in the field of music and dance. She has masters in music from Tamil Nadu University, Thanjavur. She is the state third rank holder in Bharatnatyam Vidvat proficiency grade examinations of Karnataka secondary education examination. Welcome, Dr. Vijayalakshmi.
It's a pleasure to be meeting you on this, and thank you so much for inviting me.
Yeah. So now my first question to you is, what are the reasons you chose to pursue Indian classical music and dance, not just as a hobby, but more seriously?
I come from a family of art lovers and artists, basically.
Yeah.
And probably even before I started to talk, I started to hum, I started to sing. And that was what was seen by my mother. And she started teaching me small compositions. And then I always had a either my maternal or my paternal grandmother staying with us. So they would, one of them would teach us some kind of singing, and it would be usually, both of us. When I say us, I mean it's me and my sister. So both of us would, and it was like we were challenging one another as to who's going to pick it up faster, whatever is being taught. And the other thing my sister would do is she would wear Amma's saris, play music on the radio, the old time Vivid Bharati, and whatever she could. We didn't know which channel to tune into because we were really so little, 4 or 5 year old. But she would just go on turning it till she gets some music. And irrespective of what that song meant, what it meant, she would just stand in front of the mirror and she would start moving. And seeing her, move her hands and feet, I would also feel it, step in. And when my mother saw that, then she said, "Yes, we need to, pursue the dance also." And it so happened, my first guru was when we were residing in Gujarat in Vadodara, and and we were so fortunate that we got South Indians as teachers, and we could pursue South Indian classical music and Bharatnatyam in the western state of Gujarat. And actually, I would say it is the gurus who motivated us to pursue this more seriously. And the kind of love for the art form that, of course, the family members and the gurus instilled is what made me pursue it more seriously. And I realized that, it helped me in some way or the other, because constantly going into the books and studying all the time did not help. So just like it is said that all work and no play makes one dull, I realized that not singing or not dancing will not help me do my studies properly. So it was more of an enabler rather than in any form of any. It wasn't a form of disadvantage for me to pursue my studies at any point of time. And basically, even in the primary school itself, I was very serious about it when I didn't know whether it is going to be an enabler or a disabler. But the seriousness came into it because of the kind of love for the art which was instilled by the family and the gurus. The gurus
So
actually they played
so
a
the
very big role in that.
yeah, so the seeds were sown quite early in young childhood. So first it was recognized by your mother, and then you give the credit to your gurus, but it's the shishya that also matters a lot. Now, as it is going into classical dance and classical music is so much taxing. And as a medical student, also the life is extremely hard. So, how did you manage both?
Actually, as I told you, I found it to be an enabler rather than a disadvantage. And when you come back from college after a hard day or come back from school after a full day, just half an hour or 45 minutes of uh, singing or dancing helped me do my day's studies, my homework, or whatever was planned for that day much faster. And right from school, I realized that singing for half an hour or 45 minutes improved on my mathematical abilities as well. And not just that, as we came to the higher classes, when we started doing those analytical level of problems in physics or maths, I realized that the day I had practiced my music, I would do it faster and I would be able to understand that problem well and arrive at the solution in a much logical way than I did it otherwise. So that way, I had no, there was no thought at all that I should give up my music for dancing for the sake of my studies because there's a lot to study. It was always a supporting, factor.
Okay, so you have put it so beautifully. I hope many people listen to this and they hear you and they get inspired. And it's a very nice and positive message for the young students too. Because if you start any of these activities at a younger age, so they lead to your overall development, all other faculties besides your physical, mental, emotional, spiritual, it helps in the overall growth.
Yeah, actually, if you see uh, Indian music, when you talk of Indian music, it is made of notes, what we call as the swaras, and then you have the swaras are arranged in different combinations to make ragas, and then you have the rhythm, what we call as the tal, and all these things have a lot of calculations in it. And only when it's not just simply calculating just like that, just like how you recite your mathematical tables or whatever. There's a lot of thought that goes into it when you do the calculations, and you have to keep that what we call as one tala chakra, what we call as an avartan. You have to keep to that time. You just cannot, move across, beyond that time. Even a fraction, if you move, then it goes out of the rhythm. So constantly your mind is working. And when you even listen to music, your constantly mind is working, trying to find out which rag these notes belong to. And then you try to figure out which raga is this. And then you think which composition you know or you heard of. You start thinking of more and more compositions. And then you remember those lyrics. So it helps not just your mathematical ability, it helps your memory. And it helps your concentration also because once you are engrossed into that raga or into that song, whatever you are doing, it's very difficult to come out of it until you are completely satisfied. So that kind of when you give that kind of effort into it, your concentration and memory both improve. So you'll be able to one will be able to definitely do the studies much better when you are into especially music.
It's okay. As a student, you managed fine. Then, after becoming a specialist, coming into the practice, after marriage, having a family, then how did you balance all the responsibilities? One. And second, how does your family contribute to your achievements? How will you put
So
it?
I'll answer the first part first. We've just celebrated Ganesh Chaturthi, and for Ganesha, we whenever we make any prasad, it is to be the quantity is supposed to be 21. His favorite number is 21, so we make 21 items.
Okay.
So in our Indian context, what we said is something we do continuously for 21 days. It becomes a habit, and
Yeah.
by the time I'm married, I have done it for 21 years.
The-
By the time I have a child, I have done it for longer than 21 years.
yeah.
So it's something that I cannot come out of because of my child or my husband or because of my in-laws or something. It's you've gone into it now. You cannot be removed out of it. So that was
I,
the
I
state.
simply loved it. I simply loved it. Yes. Yes. Beautifully said.
and
And yeah.
and to tell the second part of it,
Hmm.
the day my son was born, he was born in the night, and he was delivered by the cesarean section. And the minute I was out of the effect of the
Anesthesia.
sedation, the first thing I wanted to do is hold my baby and sing to him, whether he understood or not. So
Uh-huh.
that tendency is so much. And as my son grew, whether I mean, even before, like he was 3 or 4 months of age, if he has to sleep, he would cry. And if you sing the song, only he would sleep. And it would be the same lullaby that he wanted to hear. If you change the song, he would cry. He would say, "This is not," I mean, it was an indication that this is not what I wanted. So he was an enabler in that way, in
Uh-huh.
helping me pursue my music. And my husband has always been supportive. In fact, if today I am doing music therapy, it was him. He said, I used to always complain to him with so much of responsibility. I think there will be a day when I'm not able to manage both. Either I'll have to quit my profession or I'll have to quit my music. I don't know how I'm going to. So he would say, you have to strike a balance between those, both. So how do you manage? Try to find, use melody for treating the maladies of your patient. So use music through a therapeutic angle. Then you will be able to strike a balance. So it was his the ideas that he gave me, that that spark which
Uh-huh.
he ignited, that today I'm a music therapist as well.
Okay. Yeah, I've come to know that you have been invited recently by universities of USA and New Zealand for discussions to include Indian music into music therapy curriculum there. So, how do you foresee it, the future of
So,
this?
so
Yeah,
yeah,
because
actually,
it's a great achievement. It's an honor for us. Yeah, would like to hear from
actually,
you.
if you look at music therapy training in India, it is very unstructured. And as of now, there is no degree course or postgraduate course, or in fact, even a postgraduate diploma offered by any recognized university in our country. There are a lot of courses, but they are not those like how we have our bachelor's degree or our master's
Hmm.
degree in India. And who is qualified to be a faculty member for training people in music therapy? There are no guidelines. Like when you have medical colleges, you have faculty guidelines given by the National Medical Commission. When you have other higher education centers, the UGC gives the guidelines. So what are the basic? In India, it is not there. And what uh, Indian music, as you know, India has a very rich, vast heritage of music. There's a lot of variety, and there is a lot of scope for this music. Each one is practicing it in their own way when it comes to music therapy in
Hmm.
India. But the Westerners have always had a structured curriculum. They have, bachelors in music therapy, masters in music therapy, up to the PhD. They have, recognized degrees. They have licensures, like how we have the registrations with the medical council. They have licensures. The music therapists are licensed, and so far they have not, incorporated Indian music into their music therapy curriculum. And the fact that today we are getting recognized, our music is getting recognized as something which will have therapeutic value even for the Westerners, is a matter of great pride for us. And I should give it to the so many artists from India who are not just living abroad, those who are also visiting and performing there and actually spreading our the glory of our art far and wide. And that is what has actually caused that impact in their minds that Indian music should be incorporated into the curriculum. And of course, migration of people from India abroad. So they've been living there for so many years. So they are still Indian. Their heart is Indian, but they have become citizens of the US or Europe or wherever they are
Yeah.
living. So they have a mindset which is a mix, but still, the genetic makeup has something Indian with them, which will definitely respond. That is what they have realized, that these kind of clientele will probably respond only to the the music that comes from their roots. And so they thought it is always better that their students are also trained in these aspects, so that they recognize the needs of their clients and they are able to deliver the therapy better. So that itself I look at it as a positive thing for us.
Yeah.
We had one initial meeting where I really foresee a very bright future, and it is a dream actually for me to see Indian music therapy not just incorporated to the curriculum abroad, to see a proper course curriculum being developed in India, and we should
Yeah.
have similar courses in India as well.
Yeah, we look forward to that you take it way forward, and we have these structured courses in India too. It's such a pleasure talking to you. You are such an inspiration. I would like you to give a message to our colleague doctors, uh, any doctor for that matter, but especially as I am an intensivist for my intensivist community, uh, how music or dance helps you, or how to de-stress oneself, one this. And another message for the youngsters, the medical students, the budding doctors of future, advice on how they cope up with their uh, challenges in life, both professionally, and how motivate them to have a passion too.
Yeah. So I'll first answer the first part of the question: how a critical care giver can benefit from art. Art in any form, it not be music or dance. It can be any form of either the visual arts or the performing arts. It could be whether you pursue painting, or whether you pursue embroidery, or whatever kind of art form is a great enabler. It's a great stress buster. But music and of course, dance, what we call, everybody cannot dance, but everybody can move. So we call it today, we call it as movement therapy. And when we inculcate Indian dance into it, we call it as creative movement therapy. It's a great, boon to us. Um, as a critical care physician, you can use music a lot for pain management. Particularly, you will see how much less dose of the analgesics and sedatives you will have to give your patients when you use music in your critical care setting. The other thing is, when you have multiple patients in the critical care setting, and I know all of you would have gone through that, so much of that stress when the pandemic took off and we didn't have an idea of how we are going to manage. We didn't know how COVID patient is supposed to be treated. Like we were all learning. Yeah,
Yes.
today we are better off. But at that point of time, it's not just the patient; it is the patient's family who's outside, the nursing staff, the paramedical team, and the team of the critical care. The kind of stress you all, uh, as a team, all healthcare professionals went through would have been immense. it's not just during the pandemic, even otherwise, when you have multiple patients in the ward in critical care, you have your monitors beeping all the time. So your mind is constantly under stress because you want to do the best for your patient. You want to, you also see the caregivers are coming, they are weeping. Somebody's weeping, somebody's wailing, somebody's crying. And again, you have the burden of, calling somebody as you're giving up on someone, saying that there's nothing more you can do, you have to just
Yeah.
pray, and you have to break the bad news. You have so many aspects that stress you. Music in such circumstances is a great enabler, and basically we started music therapy in our setup for the palliative care settings and in the terminally ill, and we used it for our not just the palliative care patients, but also the caregivers, the family members, the other caregivers, and the paramedical staff. And we found that, you know, not just the person who's dying goes off peacefully. All of them are at peace and they are in acceptance of that, uh, what is coming. So life has got challenges, it's got ups and downs, and music helps you to equivocally face all the ups and downs in all equanimity, and take care of yourself at the same time. So music cares for you. So that is what I would say, that you should use music because music helps you care for yourself.
Yeah.
And for the youngsters, I have been a music teacher. I've been a dance teacher for last 2 decades. And what I see is once people come to grade 9, grade 10, the burden of studies is increasing. People are targeting NEET, people are targeting the IIT, JEE. And what they feel is, if they pursue music, dance, or any other art form, they'll not be able to concentrate on their studies, and that will,
That's the
bring
big
bring down their rank, bring down their marks, and they will not be able to pursue their chosen career path, and they give up, they discontinue at that point of time. But I have also seen students who have not given up and who have actually secured better marks than those who actually decided to give up for the sake of their studies. Even last year, I have had students who in the ICSE or the CBSE exams who got 98, 99%, and they have chose whatever career path they have chosen. They have got into it, and it is because art gives you, helps you to focus your energies. And I would tell all the youngsters to actually not, it may be music, it may be dance, it may be any form, any art form. Please continue to pursue it irrespective of what stage of life you are. And we have now music therapy has encompassed the geriatric care facility also. And even in the last stage of your life, music is your best friend. So embrace art as your friend, as your soulmate, actually, and you do very well in life.
That's a beautiful message. I'm sure many of us, our medical fraternity, will be inspired, and at the same time, they will be benefited with this. Thank you so much, Dr. Vijayalakshmi, for sparing your valuable time. And I'm so grateful to you, and I'm so happy that you have kept your commitment. I know yours was a very busy day today. In the evening, I had thought of rescheduling it, but you've just come from work, and this shows your commitment too. So thank you so much. Namaskar.
Thank you so much for inviting me once again. Namaskar.
Pleasure is ours.